guys getting their bitch tits removed. Me, for example, do I have to wait till I'm 50 to start rocking some tests and getting some abs, or what's going on here?
Do you think there's any men out there that are putting maybe too much stock in their test levels?
Yes.
2 guys, 1 bench. Shit talking, strength sports, combat sports. Game over. What's up, guys? Welcome to 2 Guys, 1 Bench,
Where we talk a lot of shit.
and we drop some truth bombs on your bitch asses.
Before you do anything else, make sure to like, share, and subscribe, and drop a comment down low.
Definitely, it'll help us out. Thank you. All right, guys, we got off an amazing interview with Dr. Kyle Gillett. Darrell?
He's out of Marek Health down in the States. You may have seen him on the Marek 𝐵.𝐆 podcast. We're really excited to have him on. He taught us a lot about hormone replacement therapy and health in general.
We definitely learned a lot, and we hope you will too.
What's up, everybody? We're here with Dr. Gillett, Dr. G. Really thrilled to have him on, Darrell. He's a leading doctor in the hormone replacement therapy. Also, he's running out of Marek Health. How's it going out there?
It's going fantastic. Thank you for having me on. It's hot in here in Kansas City, just as I'm sure it is in Canada as well. So thanks for having me on today.
Well, you're a little mistaken. We're in Canada, so it's almost winter now. We're actually,
Yeah.
I don't Fahrenheit, but it was like almost snowing. It was snowing in the mountains about 2-3 days ago. Anyways, Darrell, we're gonna hit it off.
Wow, I'm jealous.
So thanks again for joining us. We're excited to have you on, especially after seeing you on Marek 𝐵.𝐆's podcast. And one of the questions that I wanted to know was like, when it comes to getting your lab work done, what should the average person know before doing so?
When it comes to getting your lab work done, the main thing that the average person should know is they should find a knowledgeable healthcare provider, so like a nurse practitioner or physician, that is in tune with them and that they trust each other and they have good rapport so they know what labs to order. The alternative is if you do choose to do self-service labs, when you're getting your baseline labs or when you're looking for something specific, find someone that you trust that puts together lab packages. For example, Marek Health clinic where I work puts together different lab packages which you can order essentially self-service as well. That way you have as wide reaching of lab markers as possible. So if you're concerned about something in specific, then you should order the labs in order to look for what are the most likely pathologies, the highest yield.
Nice. I just want to say, you look like you're old enough to be my son, but after listening to you on the Power Project, you're wise enough to be my grandfather, so that's pretty awesome. But, you know...
Thank you.
We just want Darrell and I, just to give you a background on us, we're both, well, I don't really compete in powerlifting, not planning to right now, but 2 years ago, world champion. Darrell, he's still killing it, just getting stronger and stronger. But we're both natural athletes, so we've never really dabbled in the, the fun stuff. So it's really awesome to pick your brain here, just to learn a little more that we don't really know about. And yeah, I'm actually 42 years old, getting up there. I luckily took my matters in my own hand. I was about 370 about in February, and I said,
Wow.
Enough being a fucking fat fuck, and I'm gonna start cutting down. So I'm down about 315, feeling better. But it's always in the back of my head about, do I need to get on testosterone? What would you say, a guy like me is in that range, 42, maybe has low T levels. I did some blood work back in the day when I was trying to have a little kid, and they said my testosterone was low. So definitely wanted to pick your brain on that. What do you feel about me as a candidate?
So in general, the level of testosterone is somewhat of a relative thing. So different countries and different labs actually have different reference ranges, and they're usually based off different criteria or studies that they do. For example, some labs like LabCorp, they have a cutoff in certain ages of a total testosterone of 264. That's just one example. So different men have different levels of androgen sensitivity. So sometimes people can be at a very high testosterone level and have lots of symptoms. Sometimes people can be at a very low testosterone level and have lots of symptoms as well. And in those cases, it's important to address the confounding variables. So a lot of men notice that they have a physical or athletic decline as they age when they get into their 40s, 50s, sometimes even 60s. And often that's one of the first things, along with sexual health, that gets men interested in TRT. So when somebody's thinking about it, it's important to get multiple different fasted morning testosterone levels. That's usually when it's most accurate. For example, 8 a.m. And just like lipids, actually, there can be some significant degree of variation. So if you got it tested one time, it's possible that you could have got it tested 2 more times. This is just a hypothetical example, and it could have been significantly low both times, concerningly low. And then, or it's possible that both other times would have been significantly high. So ideally, you have multiple data points. That way, you can more accurately weigh what benefit you would have, because someone with a significantly low or an obviously hypogonadal testosterone level, maybe we need to look into pathologies that's affecting your pituitary and your brain, or even testicular pathologies, and address those instead of jumping straight to something like TRT. So an individualized risk assessment is very important, and then weighing those risks against the benefits that you might have from it.
Nice, yeah. Well, the doctor, like, we were going through fertility, whatever, we did in vitro, and it didn't turn out for us. But the doctor was, every time I went in there, he was asking me, do you do steroids? I'm like, no. Like, he was, every time, like, dude, I told you, no. And I'm a big guy, and I look probably like I'm on it. I've just been naturally big all my life. But the one thing I did, a good thing to pick your brain on is, like, I was fighting in K1 in Japan, and I've been knocked out several times. One time in the ring, I was like flatlined for like 5 minutes. Probably not the best thing, but that affect my pituitary at all? And does that affect testosterone as well?
It can, not necessarily. So there's a correlation with significant traumatic brain injury and lower testosterone levels, but it's not a super strong correlation. And there's multiple theories behind what the causation for that could be. For example, obviously if you have a significant trauma or bleed in the pituitary, it can cause impingement and dysfunction. Alternatively, it can cause the dysregulation of different neurotransmitters like serotonin, and that can dysregulate your fight or flight system. Some people have done studies on men who've been in the military, which is perhaps maybe not the same situation as you've been in, getting knocked out in fights, but it's kind of a similar thing where you might have almost like a PTSD type symptoms from that keep your sympathetic nervous system, which is the fight or flight, overactive. So you're not really able to rest or digest or regenerate similarly. So a lot of people also have sleep pathology, and we do know that sleep pathology, like obstructive sleep apnea, a lot of times it has kind of the same phenotype, like powerlifters and strongmen, and like very large individuals like yourself tend to have that, and that can also be correlated with low testosterone.
Yeah, that's pretty awesome you brought that up, because up until about a year ago, I believe I had sleep apnea. Of course, I was like 370, choking every night, having dreams of getting choked out, drowning, and then I finally got a CPAP. So it's been doing wonders for my sleep. So I wonder if I got blood work done, that would change things as well.
Yes. Yeah, I'd be curious to see what your new blood work would look like before and after CPAP. That would be very interesting to see. It is kind of interesting that you would note that you would ask kind of like how I would assess your benefit or risk if you did consider something like TRT, because a lot of people who seek TRT, they're seeking that physical health that kind of gives them the tools to stay active and healthy and keep exercising every day and have enough energy, or the sexual health component, or but many times both. But at the end of the day, a lot of men want to look something like you want to look. A large, powerful, muscular, athletic person who's exercising often. But a lot of that is genetic. So I talked about in Marek Bell's podcast a bit that there is somewhat of a correlation between the level of testosterone. I would call it a moderate correlation. I wouldn't call it a strong correlation, but there is some sort of a correlation. But there's no magic pill or there's no magic fix. It's a little bit of your, diet, a little bit of your lifestyle and exercise, and some of your hormone profile and genetics.
Nice, yeah.
Yeah, there was one thing you brought up, speaking about the correlation between test levels in natural athletes, how there wasn't a direct correlation between high or low levels to performance and physique. Do you mind going into detail a little bit about that and why that is?
Yeah, so a lot of people think that there's a very strong correlation. Russ, I think you said that a lot of people essentially, even doctors, have essentially accused you of taking steroids or doing cycles, because a lot of times you only think about it if someone has an elite level performing physique or a physique that looks exotically or extremely lean. So a lot of people who are on hormones or steroids or, TRT, which is taking a, supposedly bioidentical dose, even though usually TRT doses are more than what a natural elite level endogenous producer would produce. It's just more steady state instead of peaks and troughs. So I guess the answer to your question is it's not just a component of testosterone. The difference between a natural male that produces 30 to 70 milligrams of testosterone per week, that's probably not going to be a huge difference. So as far as body composition, how it makes them feel and how much energy they have, it could be a huge difference. For example, a lot of people start treating their sleep apnea with a CPAP, and they might only slightly increase their testosterone arbitrarily, let's say by 20%, but they feel so much better. They start exercising and they have more energy in general, and they might lose a bunch of body fat and maintain their muscle mass while doing it.
Definitely. I mean, I've dropped about 60 pounds, and that I could maybe correlate that new energy to actually drop that weight from having the CPAP and just being I got more energy. Before, I used to have to take midday naps, like power naps and stuff like that, because I was obviously just waking up, not getting enough oxygen, going back to sleep. So it's definitely been great. I recommend it to everybody. But a lot of people, they can't handle the mask. I don't know. It's they try it for a night or two and that's not for me. I'm well, then you're not dying every night like I was. So.
Yeah. And I'm not a sleep specialist, but I know that there's nasal CPAPs. There's various sorts of non-invasive masks. There's also tap oral appliances that a dentist can fit you for, that in cases of people that just have an extremely large tongue, that can potentially help.
So you touched on why someone would come to you if they had low levels. Is there ever a time where if someone has a high level that could be detrimental to their health? And what could it do to them negatively? Or is it always a positive?
I assume when you're saying a high level, you mean kind of a high natural producer.
High natural.
From time to time, we do see people who are very high natural producers that have extremely high total and free testosterone levels. And some of them have very increased libidos. Some of them have very increased stress responses or fight or flight responses, and they feel tired, paradoxically tired. So there's always, cases of outliers, but they're not too common. In general, if you have a higher testosterone level, it usually somewhat correlates with quality of life. So we don't see too many people with very high testosterone levels to come in, but there's always outliers.
All right, yeah, let's kind of rewind it a bit. We got ahead of ourselves. Let's get to the basics. So for those out there that don't even really know, I was having lunch with one of my fighters. He's been punched several times, and we're having this awesome interview. We're talking about testosterone replacement therapy. He's like, oh, is that what TRT means, man? I was talking to Eric. For someone like Eric, that doesn't really understand these things, what is hormone replacement therapy?
Yeah, so hormone replacement therapy, or HRT, encompasses both men's and women's hormone replacement therapy. In kind of the classical context, it is a treatment for age-related decline in either female hormones or male hormones. So classically with women's hormone replacement therapy, If they still have their uterus, then usually it's a combination of estrogen and progesterone, up to, usually don't start after age 60 or so, certainly. And you usually do it for a short period of time to help with vasomotor symptoms. So when women go through menopause, it's obviously very different than when men go through andropause or age decline of testosterone. Andropause is obviously not a true medical term, but it's to fix those symptoms, and then you slowly wean off of it and stop it because of things like breast cancer risk. So if they don't have a uterus, then you don't need progesterone, but that's essentially women's HRT at its bare bones. Men's HRT or TRT usually consists of testosterone, and the classical case of it is, again, the aging male, perhaps a little bit older than the average women on HRT, but there's obviously variations. There's some men in their 20s that are on it. There's some men that are much older, in 70s and 80s, that are on it as well. But if that's the classical women's case, starting at 55 and going to, early 60s, the classical men's case would be, starting at 50 or 60 and continuing on without as much urgency to wean off. So there's a lot of differences in between the genders with HRT.
Well, I don't know about Darrell, but my wife on the monthly goes insane. Would she be a candidate for some sort of hormonal help there? Because I'm willing to sign up for anything. It's like hell week every month, man. What's going on there?
So usually with women, you wait until menopause. It kind of depends on, obviously, if they have a uterus or not. If they do, then you can track to see how long that they've been amenorrheic or without a menstrual period. With your audience, I don't know how much this applies to them, but usually wait until a woman is postmenopausal to begin HRT. If someone's wife happens to get a hysterectomy or their uterus out, and they get their ovaries out at the same time, then often the obstetrician will consider starting HRT at that time as well, just to help protect the bones, prevent osteoporosis, prevent cardiovascular disease from a lack of estrogen.
So I got a question. It's more so about female athletes. You're seeing it more and more now with women in strength sports. There's obviously enhanced female athletes. How would that affect things with them later in life? Would they be more of a candidate or less of a candidate to be on hormone replacement?
It depends on what performance enhancing compounds they're taking. If they're taking androgens or anabolic androgenic steroids, then it would neither make them a better candidate nor a worse candidate. It just kind of depends on the individual situation. Now, if they're doing things that are more aggressive, that decreases their total estrogenic load, then you could be slightly more concerned for cardiovascular disease. So potentially or theoretically, it could make them a slightly better candidate, but it just depends on the individual situation.
And another thing I heard you touch on the Mark Bell podcast was you were saying people with certain contraindications as to why they may not want to go on TRT, like if you have gyno, balding. Luckily, I have both, and that would be a bad candidate. Is there a bad candidate for women?
If a woman is particularly prone to breast cancer, then that would make her a pretty bad candidate as well. If a woman's prone to uterine cancer, that would make her a bad candidate. So there's definitely some pretty poor candidates. If she's over the age of 60, she's a pretty poor candidate for the initiation of HRT.
Okay, so we're talking about bad candidates. What is a good candidate? I mean, say me, for example. Do I have to wait till I'm 50 to start rocking some tests and getting some abs, or what's going on here?
So obviously many men never need TRT. A lot of times it's just a point where the benefits begin to outweigh the risks. And maybe that point never gets there. And as men age, usually the benefits of TRT starts to increase, but usually the risks increase as well. So if you're planning to do something for a lifetime, it's difficult to, extrapolate the trajectory of the risks and the benefits and say, yes, the risks are always going to outweigh the benefits, or no, the risks are never going to outweigh the benefits. but that's what a physician does. That's what a healthcare provider does when they're assessing the like how good of a candidate you are. They're not only assessing you today, but they're kind of doing an assessment of how good of a candidate you'll be in the future to remain on it. So sometimes waiting will make you a better candidate, and sometimes it will make you a worse candidate. But that's how we predict it.
I had a question about hormone levels and activity, like whether it's, I don't know, working out or people that are doing recreational drugs. Like, what are some things that are hurting your hormone levels in male and female athletes that we don't really realize?
There's a lot of things that will affect your hormone profile. Some of them more acutely affect it. For example, there's a big debate on the frequency of sexual activity and how that affects your hormone profile. Does it increase it? Does it decrease it? And it's kind of like anything else, or there's a big debate about diet as well. So I don't know how often the weeds we want to get with those things, but it looks like at the end of the day, over a long period of time, so diet and sexual activity, things like that, can acutely affect it both to affect your hormones and both crash them or potentially increase them slightly. But over a long period of time, moderation in both things is going to be the best for preserving a nice, healthy, stable hormone profile. Some other substances that can affect it: nicotine can certainly affect it. Opiates can certainly affect it, including kratom, which is kind of a very weak opioid or opiate, technically opiate, since it's obviously not synthetic. But it does agonize some of the receptors. So those can all affect your hormone profile. There's other things that can as well. There's a little bit of a debate about phytoestrogens, but potentially they could as well.
So on the Power Project, I heard you talking about fiber, prebiotics, and I've been telling people a little bit secret to my weight loss was I was throwing a tablespoon of Metamucil in my protein shake every day. And number one, I don't want to get too in detail, but I'm a lot healthier when I'm going to the washroom, that's for sure. But I think it just almost kind of restored my gut health a bit. Could we talk a little bit about that and the importance of fiber and how, your gut health and all that needs to be in check as well?
Absolutely. One of my favorite topics. So I actually went through a decent amount of weight loss. I lost about 40 or 50 pounds after I had my first child as well. And I also did it with the help of using various sorts of fiber. So there's a lot of different benefits to fiber. One of them, as kind of mentioned, is it helps your gut health and has the potential to decrease certain types of colon cancers. Another benefit is that it can help with satiety, especially if you're eating very low volume of food. So there's kind of these different camps that say, yeah, you need to get your essential amino acids and fatty acids in, and a lot of that helps with satiety, things that smell good, things that give you that gustatory response. So that obviously helps, and that's one component. And then another component is just pure volume of food. And there's obviously other factors as well, but a lot of times people overemphasize one of those aspects. So that's another benefit of fiber.
Nice, yeah. It's definitely helped me out, and I'm interested, how did you lose that 40 pounds? Were you doing that plus some intermittent fasting as well, or?
I'm not a good intermittent faster. It's theoretically excellent for longevity. It kind of helps give you a break from that the mTOR response. So there's many benefits of it, and it can also help teach people satiety. I did it mostly with adding in things like fiber, adding in a lot of my favorite foods like spinach, and then also going on a very low liquid calorie diet. So my only liquid calories were essentially the protein shake that had the fiber in it.
So we want to talk a little bit about you and your career, what you do, and where you work.
Right now, I do have a physical clinic, and I still have my own patients that I'm their primary care provider for. In addition to that, I do urgent care shifts, one of which I'm doing tonight, and another which I'm doing Saturday. And I also go to the hospital, deliver babies, and see newborns and such. So I work there kind of outside of Marek, and it's a faith-based clinic. that I still enjoy doing. And at some point, I plan to do that indefinitely. I also work at Marek Health. A lot of people know it as Derek's Health Optimization Clinic. And I recently took a role as the medical director there. So it's all telemedicine based at this time, but we do lots of different things. For example, hair loss prevention. I actually used to cut and color hair before I was a physician. So I love my hair. I used to have long hair as well, but we love doing our hair loss prevention. We do cosmetic medicine. We do cosmetic and physical anti-aging. And we also do, natural performance enhancement and testosterone optimization, and obviously HRT management as well, and fertility and PCOS and many other things. So one thing that I like about it is it kind of reminds me of the academic environments where I trained. We're always wanting to learn more, and we instill in each other the desire to be a lifelong learner. So if you're doing something that's a little bit off the deep end, if you will, or something that's not very mainstream at this point, but it probably will in the future, true preventative medicine is kind of the way I think of it. You have to stay on your toes as far as remaining evidence-based.
So you mentioned natural performance enhancement. Do you mind going into detail a little bit on that?
Yeah, definitely. So lots of natural athletes are not really looking for all vectors of optimizing performance. So bodybuilders talk often about they want to optimize all the different vectors for muscle gaining. But when it comes to performance, you can optimize many vectors as well. For example, optimize cholinergic signaling in your central nervous system. So there's lots of ways to do that as well, but that can give you more coordination and more quickness, optimizing your load of stimulants. So you don't want to be overstimulated. For example, you don't want to use just caffeine, but you want to have just the right mix for you. And then you also want to kind of optimize how much blood flow you have. For example, some people will take a lot of nitric or pump products before, let's say, doing a deadlift. Perhaps you take too many and it drops your blood pressure to a point where you might pass out. So there's a happy medium for most different performance enhancing things, whether it comes to coordination or being stimulated or even aggression or aggression related responses that is outside of sex steroids.
People always talk about steroids, trenbolone sandwiches, whatever it is. The new thing right now is the SARMs. SARMs coming out, and I just believe that what I hear all these gym bros, usually includes a neck tattoo and some frosted tips, but what they always, he's gonna kill me, but he's always talking, SARMs, there's no real side effects for SARMs, I'm like, well, it's just because they haven't really had long-term studies on these things, and they're in a kind of a gray zone where you can still order them, but they're not for human consumption. And I just feel, people are setting themselves up for a bit of a shocker when they find out what these are doing to their bodies, right?
Yeah, I agree. And I've personally seen a lot of side effects from SARMs. They can definitely do a lot of damage. And we know that anecdotally. There are a few, there is clinical literature about SARMs. They're definitely not safe and they're definitely not side effect free. I've seen the side effects, myself. So until they're FDA approved for a certain indication, which I doubt that they will be ever improved for performance enhancement, if any of them ever get approved, then obviously we recommend that people don't do them. It's kind of like the devil that you know versus the devil that you don't know. You kind of rather deal with the devil that you know.
What are some of the negative side effects? Because I see now over social media, women getting into SARMs because, like Russ was talking about, people don't think there's those side effects, and obviously you know better. What are some of those side effects, especially for women? Even
though they are a selective androgen receptor modifier, they can still cause viralization. So very similar side effects to other steroids. I am obviously not a SARMs expert. I'm not a research scientist that studies research chemicals, but I do think that they can also cause acne, and then they can also cause pituitary suppression. So the hormones that women and men both naturally have to, induce, a healthy ovarian function and ovulation, they can inhibit that function as well.
Yeah, I always just say, I tell my clients, or I'm a personal trainer and a coach as well. I'm just like, there is no kind of like safe way to take anything. If you're taking anything, generally there's going to be a side effect. Any kind of pill.
The scariest side, and sorry if I cut you off, but yeah, the scariest side effects are the ones that you present themselves years and years down the line that you might not even know about. For example, perhaps SARMs cause some sort of epigenetic modification, methylation or deacetylation of the DNA somewhere. And perhaps that woman has an offspring later on in her life. And, maybe there's epigenetic changes because of the SARMs, that's probably an unlikely hypothetical example, but maybe they lead to more plaque buildup in her arteries. And it's plaque buildup that's not in her coronaries or not in her carotids. Maybe it's in the tiny little capillaries that's in the microvasculature of her brain. And perhaps she gets dementia 5 years earlier because of relative lack of oxygen down the line. So those are pretty scary side effects.
That's great. You mentioned epigenetics, and I'm not an expert, but basically it's, you're passing on your good or bad decisions onto your offspring through your life choices. So yeah, if your father was a raging alcoholic, there's a good chance you might be. And yeah, I guess same thing if you're taking steroids or SARMs modifying your DNA, you're passing that on, right?
It's applicable to pretty much everything. There's just certain pathologies like obesity that we have they're more well studied at this point.
When it comes to obesity, is there a correlation between lower test with that? And would that someone who's more overweight be a better candidate to get on hormone replacement?
Yes, there is a correlation between obesity and lower testosterone. It would make them have higher risk and potentially higher benefit as well. So obviously addressing the pathology to see if the secondary pathology, which is the low testosterone, corrects itself is usually the correct way to go. So usually with weight loss or treatment of the comorbidities like sleep apnea or whatever the case may be, usually if you treat those, then the obesity will resolve and the testosterone will return to normal. But that's not 100% given. They've had trials for different drugs that are specifically for obese men that have low testosterone related to obesity. Androzol was, I believe, the molecule that was looked at, which is one of the distereoisomers of Clomid. Enclomiphene, I believe, is the generic of what they were going to brand name as Androzol. It didn't work out, and it's no longer in the FDA approval process, but different candidates have been looked at for temporarily helping increase testosterone back to a natural level while male, helps with it.
So when you're working at Marek and someone comes into you after they've got their lab work done or they do it with you, what does your average person look like in terms of, like, let's say for a man, test levels? Are most guys concerned about it, but they're pretty fine? Do you find most guys come in worrying that they're way too low and they're right about average? Like, what's the normal person look like?
For people who come to Marek that don't currently have another doctor, because a lot of people do come to Marek as transfer patients, or they already have a doctor, or they've had blood work recently. Many times we find a pathology other than low testosterone that's explaining their symptoms. So it could be a new incidence of diabetes, or it could be a new incidence of liver disease or sleep apnea or some other pathology. But as far as their testosterone levels, if I had to guess on average, it would probably be low normal. That being said, we have dots all across the board because we have patients from such a wide-ranging patient population. So some people come to us and they have no insurance and they've never seen a doctor in 25 years. And some people come to us and they have a family doctor that they've seen for 20 years that they have a great relationship with. a great rapport with, and they're just looking for maybe a second opinion.
Do you think there's any men out there that are putting maybe too much stock in their test levels? Because obviously in gym and like the fitness industry, everybody, it's kind of like, oh, high testosterone is the desired goal. But as you talked about, there's, for natural people, you could be low test and be a great athlete or have a great physique. So do you think people maybe put too much stock into having a supremely high test level?
Yes. Yeah, I don't know how much to elaborate more on that, but I think people do put too much stock in it. There's also somewhat of almost a placebo effect where, maybe you have a 45-year-old guy and he's gone the last decade and he's kind of burning the candle at both ends and working very hard and neglecting the fitness and diet aspect. And there's kind of, he wants to kickstart with something. And, I remember even when I was a teenager in college, if I wanted to get on a fitness kick or a workout kick or really get into shape, then, you go to the supplement store and get a pre-workout that probably has no ingredients of high efficacy and maybe some creatine. And it felt like it worked amazing. But if I was just taking placebo powder, it probably would have worked just as well.
I recently went down a rabbit hole. I believe this physician, he's a plastic surgeon and he's in Australia, but he does a lot of he's on Instagram, you can see a lot of his operations, and he has a highlight of just guys getting their bitch tits removed. And I was just watching him, like, holy shit, these guys are just, he's doing a slice below the nipple and then pulling out this big ball of breast tissue, and I'm like, Jesus. And if I if I was considering HRT, that would be one of my major concerns. And another concern is what if I start just taking testosterone and then I start getting some breast tissue, then I got to take some estrogen blockers, and then I got to take this and that, and pretty soon I'm on a whole smorgasbord of drugs that I have to on a weekly basis, which is not really what I want to do.
That's a really good question. So you don't want to ride the pharmaceutical cascade. So the body is made with many different homeostatic windows and buffer zones. So it's kind of like a train that's chugging forward on the tracks. The train can actually wiggle a little bit on the tracks, but the rails keep it within the homeostatic window or its buffer zone. So the body's kind of the same way. It's been designed with, hundreds, if not thousands of different interacting positive and negative feedback mechanisms. And when you alter one of the major ones, which is your sex hormones, it makes it more likely that you're going to get off the rails in one way or another. So whether it has to do with your liver or your kidneys, specifically the renin-angiotensin system, or the lipids. So it dysregulates your lipids as well. A lot of times you do end up with a pharmaceutical cascade where you end up on a low dose of a or maybe a high dose of a blood pressure medicine, and you're more worried about plaque buildup because for your androgen load. And then, there's just a lot of other things to worry about down that pharmaceutical cascade. And I'm a big proponent that diet and exercise, lifestyle in general, sleep hygiene is another big one of them. Maybe that's the lifestyle trifecta. It is more powerful than any medication or therapy that we can prescribe. That's why I love prescribing, this food as medicine or prescribing this exercise regimen as medicine because it works. But when you alter something as big as your hormone profile, then no longer is the argument that, yes, we just need to do diet and exercise and sleep and get sunlight and it'll be fine. So that LDL cholesterol of 200 something is, you probably need to look into that more. And that might be controversial, which seems crazy to think that it would be controversial. But when you alter one of those homeostatic zones, then you need to dig deeper.
Question for myself. So if I'm pushing myself training, natural athlete, How often should someone like me be getting lab work done or seeing the doctor in general? Because I find that a lot of people don't really go and get checked out, and they feel just because they work out, they're healthy, and if you look good, you're healthy. But obviously, we know that's not the case. So, how often should someone who's competing and training be going in to see their doctor and getting lab work done? And does it change from a different or everyday guy?
For the average metabolically healthy North American, which is about 10% of the population, in my opinion, I would say twice a year. Once for fasting labs and a quick chat with the doctor, and once for non-fasting labs. That way you see how things are at both low tide and high tide. Or perhaps even go in once to the doctor when you're on vacation and relaxing, and then perhaps try to schedule some labs and a doctor appointment in the middle of your most stressed time as well, just to see how things are at both low tide and high tide.
That makes sense. Yeah.
Yeah, definitely. And as I think one more thing you should maybe add in, or I think I should add in, is that as you get older, obviously you got to go more often because, I'm in my 40s now. There's a higher chance of me just dropping one day. Luckily I haven't modified my hormonal, balance. So I kind of take pride in that as well. And, being a lifetime juice-free athlete. So do you have any suggestions for people that are, considering, okay, let's say right now we're listening to the podcast, they're hearing you and they go, okay, well, I want to kind of pursue this. How do they get a hold of you? And, or how would they go locally somewhere? What do you recommend?
So I guess there's kind of two parts to that answer. One is wherever they live. I obviously recommend finding a physician or a healthcare provider, a primary care doctor that they're able to trust and that they have decent rapport with. That way they can stay with them, as they age, perhaps the rest of their life if they don't move. And if you need to read profiles, most healthcare systems have the profiles of their various doctors on there, and that can help you find someone who is a good fit for you. In order to find me, I have an Instagram account, Kyle Gillett, MD, and you can also find me working at MarekHealth.com. My advice as far as where to start, even if they want to get some self-service labs, is get more than just the very basics, especially if this is going to be the baseline labs for the rest of their life. So get extra things. For example, if you have a family history of heart disease, get some extra lipid markers or lipid studies to dig in a little bit deeper. If you're overweight or have a family history of diabetes, get a fasting insulin, perhaps even get a lipo profile, which will give you your insulin resistance from lipids. So dig a little bit deeper in your baseline labs as well.
Thanks for, doing this interview. We really learned a lot here, and for taking your time out of your day. As a doctor, I know an hour of your time is worth a lot of money. So thanks a lot. And we'd like to keep in touch and perhaps get you on again.
Absolutely. I'd love to, and I really appreciate the invitation.
Awesome. Well, have a great day, and we'll be popping this up soon. So thanks for everything, and have a tremendous year as well.
All right, guys, thanks for tuning in.
I want to give a shout out to our sponsors before we leave. We got Misfit here.
Yeah, man, we got Resolute, Boost CBD, Bridge City Brand,
Scalp Tech Inc.
Scalp Tech. We got a whole bunch of shit. Check out our captions for discount codes on all of those. And don't forget to eat big,
Train hard,
and always be fight ready.